It has always been said that the two things that divide a nation, that divide a people, that divide a community, even a family, are politics and religion. Most of you, if not all of you, would by now have viewed the video which has gone viral of a Catholic priest in a cemetery officiating a burial, breaking down, snapping at what we think are congregants, what we think are grievers, persons who are there to support the family as they grieve the loss of a child, of a brother, of a nephew, of a grandchild. And you would have seen this priest totally losing it and just railing at person or persons unseen. What you would not have seen, what the video does not say, is that the priest in question, Father Albert, was officiating the burial of his nephew. So you have an uncle who is grieving the loss of his nephew, and he's also officiating. He's also the one overseeing the burial of this nephew. So it's kind of a double jeopardy, so to speak. As a person, he's grieving the loss of a loved one, and as a priest, he is trying to do his best as a shepherd, not just of the community, but of his family as well. And we have high expectations of men of the cloth, ministers of government, public figures. We have high expectations of them. Sometimes I say unrealistic expectations of them because we do not hold ourselves to the same standard. However, as the old adage goes, of whom much is given, much is expected. So when you hold office, whether it is a religious office, whether it is a political office, or whether it is a public office, there is much that is expected of you. However, there is only so much that one can take. There is only so much that one can go through after immense harassment and persecution. How much is enough? How much is too much? Well, one can argue that it depends on the person. It depends on the disposition. It depends on the upbringing. It depends on the training, the life experiences. As a priest, you would expect a little bit more grace under fire. You would expect a little more malleability. You would expect a little bit more understanding, a little bit more mellowness. However, bear in mind that this is a man who is grieving, albeit a priest. What the video does not show, what the audio in the video does not include, is the harassment, is the continuous interruption of the proceedings. Bear in mind, it is a burial. Bear in mind that despite the fact that it was not in a church building, an ordained church building, it is still considered sacred ground for those of us who are Christians, who are Catholics in this case. From my understanding, there was a pastor who kept interrupting the proceedings. And let me tell you something. As a Catholic, I have been invited to various churches, and while sitting in the congregation, listening to what the pastors are saying, they're condemning me. Not realizing, perhaps, and I'd like to think that they're not realizing that there is a Catholic in the audience, but they like to do that. They like to condemn Catholics in particular Because we are different, because we have rituals, because we have rites, because we adhere to tenets of our faith which are different to theirs. And so the harassment oftentimes is continuous, and it is oftentimes unbearable. There have been occasions where I have gotten up and left. I have had words with pastors in their own church because I feel offended as a guest to your house, which is what it is. I am a guest in your house. You've invited me into your home, and to sit there and take on abuse, that ain't gonna happen. Because if I invite you to my home, I'm going to treat you better than I treat myself, because you're a guest in my home. You're a guest in my home, and I think it is unfair. It is unfair for some denominations, and bear in mind, these are all Christians. We are all Christians, whether we're Seventh-day Adventists, whether we're Catholics, whether we're Jehovah's Witnesses, whether we are Church of God, whether we are Mormons, whatever the denomination is, we are Christian for the mere fact that we are followers of Christ, that we believe in one God. And to show utter disrespect at a religious ceremony is unpardonable. It's unconscionable, and it is egregious to the highest denominator. It is wrong. I do not care whether you believe, whether you don't believe. If you do not believe and you are so convinced in your disbelief and you have no appreciation, no understanding, no respect for, pay your last respects elsewhere. Go to the home of the deceased. Pay your respects to the parents and the family in private, but do not come to a ceremony, a religious rite, and interrupt. That is wrong. And particularly if you are a man of the cloth and you have your own flock to shepherd, it is wrong. Without question, it is wrong. I have been to burials where at the burial ground people talk and they talk and they talk and they talk and they laugh and they laugh and they're loud, and it's so wrong what they're doing. You know, it's almost as if it doesn't matter. We just can't tell women, but there are people, their loved ones, grieving, sorrowing, and you making light of their grief. This is what you're doing. By your brash and harsh behavior, you have no concern for those who are grieving, who have lost a loved one. You have no concern for that, and that is wrong. I cannot say how categorical this whole behavior is, how wrong it is. It is wrong, it is wrong, it is wrong. However, having said all of this, I would like to implore those of us who are shepherds, who have followings, who hold public office, be very mindful. Be very, very mindful of the behavior that we exhibit, even under immense pressure. There is language that is unbecoming of certain people, and we don't expect it, and we should not tolerate it regardless, because you are an example. You are a beacon. We are looking up to you, whether it's children, whether we're adults, whether we're young adults, whether we're teenagers. Your flock is looking up to you as its shepherd to lead by example. So while I understand and I appreciate and I abhor the behavior of those who so angered the priest, I would caution him to use language that is a little bit more becoming of his station, more becoming of his title, and more becoming of his office. Yes, you are a man first and foremost, but you are a man with a vocation. You are a man who is supposed to be drawing us closer to God and be more Christ-like. And I know there are some of you who are saying, even Christ, even Jesus himself had been aroused to anger. Does that excuse it? No. But that is not to water down anything that could have led to that. It was appalling behavior to disrespect a right, to disrespect a family, to disrespect a community, the way those priests, that family, and that community was disrespected. It is wrong. Two wrongs don't make a right, though. Two wrongs do not make a right. So, and I fall to that, because I always pray for patience. That's the one thing I pray for. I pray for patience. And my spiritual guides, they will tell you all the time, that's one thing I pray for on a daily basis ever since I was a little girl, is patience. My temper is short. And so I understand. But as I get older, as I take on more responsibility, as I become more of a public figure, I learn to harness that anger, to rein it in, and to understand that I have a spotlight on me at all times, whether I'm in office, whether I'm out of office, whether I'm just at my home, walking the streets. I know that the expectations of me from the public is a little bit higher, a little bit more than a regular person. And so I conclude this segment by offering my deepest and sincerest condolences to the family of Father Albert on the passing of his nephew, and my deepest empathy on the harassment, the torment that he had to go through, that he had to suffer on the occasion of the burial of his nephew. What you had to go through, nobody should have to go through that. And this is where divisions come. Divisions in your own faith, divisions among other denominations, divisions among other religions, because we're all of the same religion, Christianity. We like to say, oh, that will is your Munsa, will is your, that the religion, that religion. No. The different religions, there's Christianity, there's Muslim, there's Hinduism, there's Buddhism. These are the different religions, some of the different religions. But in Christianity, there are different factions, different denominations, and I would appeal to all of us Christians to practice temperance, to practice understanding, to practice appreciation for our various nuances and differences. We're due for a break. When we come back, my guests.
You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. What happens now? You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. You'll get over heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not what happens now. Heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the fall, 'cause you'll get over heartache. Let it go as time moves on. Yes, you'll get over heartache. Carry on, it's not heartache. You'll get over heartache. You'll get over heartache. Carry on, don't fear the
Welcome back, Solutions. Thank you for staying tuned to what's happening now with Laura. 3 or 4 weeks ago, I promised that I would have had midwives on directly after I had the St. Lucia Medical and Dental Association executive on board with me. But the best laid plans sometimes go awry, and that didn't happen. But I promised you I would have them back on with me, and they are. Before I introduce you to my special guests this evening, how many of you recall growing up, I'm speaking to the ladies here, as little girls growing up, being told that girls are supposed to be seen and not be heard? That you're supposed to go to school, you're supposed to get a good education, you're supposed to get a good job, attract a good husband, be prepared to cook, be prepared to clean the house, be prepared to nurture the children, bear the children, all of which you're supposed to do between the ages of 20 and 30. How many of you recall that? And how many of you determined to have it all? The career, the husband, the children, the white picket fence. How many of you did all of this before the ripe old age of 30? Some of us weren't so lucky. Some of us were so determined to get the education, to get the career going, that we set aside our private lives for a little bit later. And then 30 came around and didn't happen, and 35. And so you push the goalpost because, you know, as a kid, you're aiming to have your kids in your 20s. So when your 20s are done and you didn't have that, you're pushing it to the 30s. And then the 30s come around and, you know, it ain't happening. You push it to a little bit later, 35. And then 35 turns to 40. And you have neither the husband nor the kids, but you're determined because you want to have the kids and you're determined to have the kids. But are you really prepared? Tonight, we're going to talk about postpartum depression. We're going to talk about childbirth after 40. We're going to talk about sex after childbirth. No, it's not yet this Let's Talk About Sex series, but we'll talk a little bit about that. We'll talk about all the things that the books do not prepare you for, particularly after the age of 40. What to expect. The stress on your body, are you even physically able, capable, or should you even attempt to birth kids after 40? Tonight, joining me are two midwives. We have with us Nurse Butcher and Nurse Leopoldi. Good evening, ladies.
Good evening.
Good evening.
Now, you guys are young, and I'll tell you one thing. I have a preconceived notion of what midwives are. So you think of the olden, the old-fashioned midwife, the older. There's a name that they call them in Creole. I can't recall it right now. But you think of the older woman that comes to the home and helps the mother to, give birth at home. You guys do not fit that stereotype at all. Tell us a little bit about yourselves and how you came into being midwives.
Okay.
Let's start with you, Ms. Butcher.
Yeah, the doctor is nice. Hi, good night. My name is Janelle Butcher. I presently work at Victoria Hospital. Have served a maximum of about 16 years. 6 years as a registered nurse and roughly 10 to 11 years as a midwife. Sometimes you start off in life and then you want to become I always wanted to become a nurse, always, from small. Yes, and sometimes when you do get there, you want something more. So I decided to venture out, and midwifery was one of what I wanted to do. So I did that, and now I am. So it was more or less moving from one stage to another. Yeah.
Wonderful. So that was a progression for you. It's like me in the business world. You're starting off as a young executive, and then you grow to be a supervisor, then a manager, and next thing you know, you're running the whole thing.
That's right.
What about you?
Okay, good night, everybody. I am Julie Marcia Leopoldi. I have been a registered nurse for 7 years. The latter 3 I have practiced as a registered nurse midwife. I started my career at the Grosile Polyclinic Accident and Emergency Department in 2012. I left in 2014 to study midwifery at Salford Lewis. I was successful and completed in 2015. Since then, I've been working at Victoria Hospital on the maternity ward. And it definitely is my passion. Mm-hmm. And I have it was a big switch for me in life because I started off with architecture. I got a degree in architecture. And it was 1 year when my grandfather fell sick. I watched my 2 aunts nurse him back to health without bringing him to the hospital. Mm-hmm. And I said, I definitely want to do this for my family. So I just went into nursing 2 months after that. And since there...
So you gave up a career in architecture. You invested in that, and
Yes,
then you decided. I could see... I'll tell you something. I'm a very compassionate person. I love my parents. I love my family. I do anything for them. Nursing is not it.
A lot of persons do.
Nursing, I can't. I'm squishing around blood. I'm seeing them in pain. I couldn't do it.
Yes.
But for you, you were so moved by that. You became a
And
nurse.
it's definitely my passion. Definitely.
You
love
have
my
not
job.
regretted at
Never,
all.
not
No.
one day.
No.
Wonderful.
Yes.
So the word I was looking for is femme shy.
Yes.
So y'all are not the typical femme shy. Yeah. Okay, so you went into nursing, and then you progressed into midwifery.
Yes.
And how is that different from regular nursing?
Midwifery is a specialty. And becoming a midwife gives you a lot of autonomy. Like you're in charge of a lot of stuff. You make a lot of decisions. You make some decisions on your own. Yes, it's a collaboration with your doctors and other colleagues, but there are a lot of decisions that you can make on your own.
Right.
So how does it work as a midwife? And so I come in, I'm pregnant, and I'm like, oh my gosh, I'm all flustered. Do I request a doctor or a midwife before? Or whomever is on schedule for that day is whom I get? How does it work?
When you do come in, the midwives, we are the ones that attend to you first, okay? And from there, depending on what's happening, the doctors, as long as we need them, they come.
Okay,
into
so
play,
the midwife-
midwives are the ones that attend to the ladies first.
And that's for natural childbirth, huh?
Yes.
Okay, so
yes.
not the midsections. Sorry, C-sections for sure is done by the doctor, surgeon, but
The actual
Procedure.
procedure, but in terms of preparation,
Okay.
yes, we are the ones who
right.
who do that.
Okay, wonderful. So tonight we're not going to be focused on too much on general midwifery for the
Right.
the swanky 20-year-old or 18-year-old or even 25-year-old or even 30-year-old who comes in. We're looking at the older, more mature mom. In your practice, in your experience, how often do you see older moms? First time older moms.
Since I've been there for roughly 10 to 11 years, I've not seen too many, but I have had a few come in. It's basically just the same procedures. We attend to them. We ask them the same questions that we do with a younger mother. It's basically the same. What may be different is that they would not say it, but then they would feel that way just by looking at you. They may feel as if like, okay, we pass this.
I shouldn't be here.
Yes, yes,
I want
shouldn't
a baby, but I shouldn't be here. Especially if the person next in the next bed is a 16-year-old. And like, what am I doing there? The one on the other side is a 20-year-old. What am I doing there?
Yes.
And you're like a granny on the bed.
And sometimes they do feel a little overwhelmed, especially their first time, and they would ask a lot of questions. Typically, what the other first-time younger mothers would ask, but then the stare, the look that they give you, and sometimes the feedback that you give them, it's important. You're there at whatever age, we will take care of you regardless. So it's also important that we make them feel as if like, hey, you're not that old, you're not granny. Okay, it happened at that time. We're going to take care of you.
Right.
Yes.
So in terms of giving birth, do you see out of those older moms that you see, do you get more C-sections or do you get more natural birth, or is it a decision that you would recommend a C-section for an older mom? Or talk to us about the actual childbearing and birthing.
Okay, in terms of deciding the mode of delivery, whether it be normal delivery or cesarean section, that depends on if they come in with any complications. And the thing is that at that age, there are some who do come in with complications, but there are some who come in and the pregnancy has gone fantastic.
Talk to us a little bit about the complications.
Okay. The older you get, you are at higher risk for some of the pregnancy complications, like having high blood pressure during the pregnancy, having diabetes during the pregnancy. These moms are prone to preterm births, stillborns, sadly, after waiting so long, or maybe it was a difficult time for you trying to get pregnant, because sometimes that's the situation.
Yes.
Other times it's just that you decided to wait, but to wait that long and have a stillborn is just really sad. They also they're also prone to having babies that are born with abnormalities.
Yes.
Okay, so it depends. If your pregnancy has gone smoothly and we see no need for a C-section, we'll definitely coach you through a normal delivery. If not, the doctor is who really decides if you're going to have the C-section. And, we hand it over to them from there, depending on if the complications are severe or not.
Right.
Adding to what she's saying, with all the abnormalities and the high blood, more or less with baby, as you get older, just to add, the eggs are affected, the ovaries, the uterus with age. So hence the reason they are more prone to all of these.
One of the things I've learned I read a lot and I love babies. So every time a relative, a family member is pregnant, I go through all the books and whatever. A lot of us, we don't realize that we're born with a finite number of eggs.
Yes, we do.
And as we get older, these eggs lose its viability.
That's right.
They get older as you get older. And you have less eggs. So getting pregnant is a little bit more difficult, as you
Yes,
alluded to.
right.
But the viability of the egg is also compromised. settling in, the reality is settling in, and it's like, oh, but you can't give it back. So that's why. But it's a real thing.
Yes,
It's a real
different
thing.
situation.
Right. Okay. So let's go back to the beginning. You're ready to have a baby.
Right.
Let's take it from there. You're ready to have a baby. What do we need to know? As older moms in particular, but just moms in general. And I'm speaking a lot for older moms because I know there is a cross section of women out there who maybe think that their time has passed, that they shouldn't even be contemplating having kids at that age. Even in their 30s, you think our lifestyle does not does not permit, but our lifestyles today, as opposed to 30 years ago, we're seeing earlier onset of hypertension, diabetes,
That's right.
and so we're coming in 30 and 35 with those conditions already. So we're ready to have a baby as a mature mom, as a mature woman. What do we need to know?
The antenatal care is most important, and that will guide your entire pregnancy.
Tell us about what antenatal is.
Antenatal is the care during the pregnancy. Okay? We have clinics at all the health centers that are actually free, and you do have an option to go to your private doctor. Okay? You have to be monitoring the blood pressure.
Before we get to antenatal care, let's start at prenatal.
Okay.
Before
you actually get pregnant.
Yes, before you
Okay.
get pregnant.
So then you're asking, okay, I want to have a baby. So
I want
what,
to have a baby.
So personally, what?
Yes.
Preparation.
Yes, I'm
Right.
ready. I have the job, tick. I have the man, tick. I have the house, tick. With the white picket fence, and the little puppy. That's everything.
Okay.
I'm ready.
All right.
What's the next step for me?
So am I ready? Me as an individual. Mentally, yes, we're ready. But physically, are we? So then we need to do our checkups. All right? We need to make sure that we can get pregnant. Okay? We most times they allow the daddies and the mom support, right? Daddies and mummies, they come in and they tell us what they want to do. They, yes, they're ready to start the family and so on. So physically, you need to know if the mom is ready, also to daddy, because both, it takes two
Right.
to tangle. Yes, and so both, they're capable, and now, most times they start them off on the folic acid,
Folic acid.
getting
So before we even get there, I'm going to interrupt because I did a lot of reading. So I'm going to be a little show off tonight.
That's okay.
I did a lot of reading. One of the things that a lot of women don't realize, though, is that they have a period,
Yes.
and so they believe, I'm having a period, so I can.
That's right.
But you can have a period and not be ovulating. How does that work? Like if you're having a period, but you're not regular. You're in other words,
all of that, and so
So you
saying that
thinking
to
I'm
think-
having a period,
so
so
then
I
can get
should be able
pregnant.
to get pregnant, right?
Yes. A lot of people think that. Yeah, go ahead.
They think that they can, but as we said earlier, it depends on the quality of the eggs.
Eggs, right. So what do we
Okay.
do now? So you said we have to make sure that the mummies and the daddies are capable.
Yes.
There are certain tests that we run? What do we do before we even start with the folic acid and whatever?
Yes.
How do we?
Tests, fertility tests, and
Okay.
so on and so
So do we
forth.
get tested?
Yes.
I want you to break it
Okay.
down to the lowest denominator. I'm serious. Break it down to the lowest denominator so we understand that it's not just because a lot of us think that we can just sit at home and we know what's going on with our bodies, but really and truly we're going to be very surprised when we go through those tests and see, okay, yeah, you're ovulating, but not every month, or there's a reason why you're irregular, or daddy, yeah, you might be ejaculating,
Right.
but you really are shooting blanks, type of thing. So we get tested. Right.
If you're most times, as far as I know, you're about to start a family. If you never really had any problems, never, my period has been normal, nothing to render excessive tests. you could start off. But then if you have had previous problems,
Right.
missing of a period, you have had other problems that would indicate fibroids and everything. So then they go as far as doing ultrasounds.
Right.
All of these things, they do all of these pre-tests so that they know that you're okay.
Right. Now, as you mentioned, fibroids, women with polycystic ovaries, does that hamper your ability to have kids, or is that okay? Like you have polycystic ovaries, but I'm not sure.
It makes it more difficult to actually conceive. But we have had patients who have polycystic ovaries and have come in pregnant. So there is the possibility. It's just that it's lower than the person without.
Okay.
Yes.
Similar with the fibroids.
Right.
Okay. So we established we're ovulating. We don't have fibroids. Or we do, and we're okay. We're good to go. We get the green light.
Yes.
Right. From then, what happens?
Yeah, you start off if you're a doctor, if he's a doctor, if he's a midwife, whoever that you have decided. But then most first time people, they go to the doctor. So the doctor directs them from there. Okay, they would start off on their certain medications like the prenatals we were talking about.
And why do we need the prenatals? Why do we need the folic acid?
The folic acid. We need it because there are certain abnormalities that we can prevent in your fetus if you take the folic acid. One of them that stands out is the spinal bifida, where the spine is not, it doesn't develop properly, and taking the folic acid can prevent that from happening. Okay. So it's
always important to have that follow, because I know there are women who don't do prenatal.
Yes,
don't,
and some of them
yeah.
they do get pregnant even before that they know they're pregnant. So then that aspect, But then, like you're saying, that you're ready, and then you go find a doctor to let them know that, hey, me and my husband, yes. So then they will start you off that way, and it would be best if a lot of people do it that way. So you know,
yes, all the precautions.
But it does not always
It happens
happen.
sometimes. Accidents
Yes.
happen.
You call it accidents.
We do silly things. We do silly things sometimes.
Yes,
We
right.
do silly things and we get caught and we're like,
We all do.
We all do.
us.
Yes, it's not an older thing or a younger
Right,
thing.
or a smarter
yeah,
thing.
sometimes
We all do.
sometimes we're a little silly. We're a little
Yes.
exuberant, and
Yes.
and these things happen.
Yes.
Right. So we're on our prenatals. We're taking our folic acid.
I've
We're
been checked up and everything by doctor. And so
STDs.
on. Yes. Oh, that's why
All
I'm
that's part
telling
of
you
your-
all part of your checkups and everything. Yes, very important.
Right.
If there is anything down there, because sometimes we may have some infection and may not be aware of it. So that is why it's important to do the checkups.
So when you do you do the STD checks, like you do the testing
They do
before
everything.
you get pregnant?
If, like you're saying, that you're planning,
If you're planning it,
they
yes.
do everything because
Okay.
this thing could harm baby. Yes,
Right.
Yes, they do as much as they can. Yeah,
Okay, great. So you're prepared, you're ready, and it takes.
yeah, kicks off.
Yes.
Yes. The egg and the sperm are doing their magic, and baby is forming. What next? What can we expect within that 9 months that we're talk to us?
You wanna go?
There's a lot you can expect.
There's a
That
lot.
clinic, your antenatal clinic, that's what
Yes,
I
we
was
were
speaking
talking
about
about-
earlier. That's most important.
Very.
I know that some people prefer their doctor, but I prefer not. I don't prefer the health center. I'd like, if you go to your doctor, that you still go to the clinic at the health center.
So you
Okay?
recommend
I
doing
would.
the clinic at the health center?
Yes, because at the health centers, before every clinic, we do a little teaching. You learn something about your pregnancy, how to cope with your pregnancy, or about how you're going to cope after your pregnancy at your clinic.
So that would help you along with the postpartum blues as well, right? So you know what to expect. So when you feel, if you do have the symptoms of the postpartum blues, you can recognize it and nip it in the bud, as you were saying.
Exactly.
Right.
Yes.
We also do testing for the urine, blood tests. We follow up. If we notice something is going wrong, we refer you. And we can do that sooner than if you have to wait for a longer time to see your doctor. Doctors are very busy. They can't do as much as we can do in the health center. They
And
have
they're
a
also
lot to-
expensive, so you can't
Yes,
always be
very
running to the
much.
doctor,
That's true.
right? So at the clinic, you do all of those lessons and teaching and whatnot, and that's free.
Yes.
Right.
Yes,
How
yes.
often does a pregnant mom have to go to clinic? How often do you go to clinic as a pregnant mom? Is it every week? Is it every month? Like, how often do you go to clinic?
It depends on the
How soon the
trimester.
right,
How,
and how soon the
far
person
you are.
comes into the how we call it, to the health center, because some of them come when they're probably 5 months, 6 months. Some come at 2 months. Some come, so it varies, but then there's an allotted time. There is something standard they use, and yeah, go ahead.
In the first trimester, that's once there are no complications. Because if there are complications, we're going to see you a lot
Frequently.
more frequently than the regular person. In the first trimester, we want to see you at least once for the month. The second trimester every 2 weeks, and in your later stages, closer to your time of birth, we're going to see you every week.
Is that right?
Yes.
And some persons don't come.
Well, I wouldn't. No, that I wouldn't want to.
Yes.
I just thought you go to clinic once a month. Or and then closer to the birth, you go to clinic
Because
more often, more frequently.
closer to your birth, a lot of things can develop.
Yes.
Especially your third trimester. Second to third trimester, a lot of things can
I
develop.
thought
along
in your
that
third
time.
trimester you would practically live at the clinic, but like in your first, second trimester, you easing, you breezing through that, Huh. But sometimes you don't even know, like in the first few months, you don't even know
That's
that
true.
you're
That's true.
pregnant.
Then again,
Yes.
But then
as
how
to
do you
what
not
time.
know? How do you not know that you're pregnant in you for 2 months, like, or 3 months? How do you not know? Isn't your period supposed to stop? Like, how
Not
don't you?
everybody.
Oh,
There are people who see a period while being pregnant.
like a regular period or just
wife was on maternity, and she was taken from maternity. She's a nurse, Nurse Lucia, Yasmin Lucia. And she was put down into casualty. And I think that have depressed her a little because that was her passion. That is her passion. And she went to do the midwifery because of her experience in losing her children. You know, she's had some very sad moments, and she didn't want to see that happen to other ladies. And I thank God that she's strong, and she's, you know, I'm proud of her because she is a people's person. You know, sorry about that. You know, that's just her drive to just see that people are well taken care of and healthy, and you know, just everything that should surround people in making sure that they're properly taken care of. That's what Nurse Lucia is all about. You know, and this young lady there, Butcher, our good friend, Nurse Butcher, and my wife's friend again, the next nurse. I'm not too familiar with her, but my wife speak about you guys, and y'all are doing a wonderful work. You know, the amount of people that would see my wife walking and saying, you know, how she, you know, took care of them when they were, you know, in labor. It's just a wonderful thing to know. But I thank God for nurses. I thank God for your work, and may God continue to bless. Butcher, God bless you, my girl.
Thank you.
Continue the good work.
Thank you.
Thank you so much for calling
You're
and
welcome.
for sharing. Sometimes you get these types of calls, and it's very sobering.
Yes.
Before we get another call, though, let me ask the question. Oh my goodness! Thank you for calling. You're on the air.
Hi, good night.
Good night.
Good night.
Good night.
I just want to.
Yeah. Hello.
Hello?
Yes. Can you turn down the volume of your television, please?
I just want to say hats off to my nurse in the red shirt.
Nurse Leopoldi.
Yeah.
Yeah, she's a brilliant midwife.
Thank you.
She delivered my son, and we're still in contact a day like today. So keep on doing what you're doing, nurses.
All right.
We definitely will.
I'm going to have to recommend.
Yeah,
When
you
my
should.
family and friends go to give birth, I'm going to have to say, ask for Nurse Butcher and ask for Nurse Leopoldi, otherwise don't give birth.
You should.
Thank
Because
you.
you're doing a brilliant job.
Apparently so. Apparently so.
Thank you.
Thank you so much for calling. Sex after birth.
After birth.
Okay.
I will answer that question.
How long after birth can you have sex without coitus interruptus? Also, is there a recommended sex position during pregnancy? Yes, you know the men I'm talking about no sex or like anything. 9 months, they're not on that. Thank you for calling. You're on the air. Good evening. Okay.
Yes, good evening.
Yes, you need to turn down the volume of your television, please. There's a feedback.
Yes, I would like to say. So with Nurse Julie, continue doing the good work that you're doing. We love you.
Oh my God! You have a cheerleading squad. Thank you for calling.
Thank you
for calling.
very much.
Yes. So could yes.
Okay, good night.
Okay. Good night. So sex after birth. How long and what sex position during pregnancy would you recommend?
You want? We should answer the during pregnancy first.
Yes.
Yes. I wouldn't sit here and tell anybody not to do this during pregnancy, right? But what you have to bear in mind, when the penis goes into the vagina, it hits where? the cervix,
cervix,
okay? And the cervix plays a very vital role in during maintaining the pregnancy. So that's what we should focus on, right? There are persons with
So make love, not rough sex.
Love.
Like none of that
gentle.
rough sex.
Yes, be gentle.
No, I have to say it like that because
Yes.
a lot of you get excited, and
Yes.
during that excitement you can get a little bit physical.
Right.
So we say
You know,
make love
and
gently
be as
and
gentle.
Yes.
Yes.
So when the cervix has a problem, you have them sometimes, we call it short cervix, where they're not able to, like you were saying, hold the pregnancy, so to speak. So as the baby gets bigger, it will tend to open. Now, as long as this part of the womb is opened,
The baby
can
comes
come
out.
out. So imagine that you're having sex that you, like you say, roughly, or you have that constant. It may cause that as well. So that is what we have to pay specific attention to. So when you have that problem, we tell them absolutely no sex. Sometimes too, they may have to come at VH, where they may have to clip it, so to speak, and have them there being monitored, right? Because the bigger the baby gets, the more pressure down there. Okay, so that is one of the reasons why we may tell them no sex or be careful. All right. If you're okay, like me in my case, I did everything as usual, right? And nothing did happen, right? So you can enjoy yourself. Husbands, don't feel as if you'll knock baby head. Right? Yes.
They think they need to do.
But like you say, be gentle. You know, you have your baby growing in there, and again another reason to like we were talking earlier on, infections, and
Right,
the constant jabbing in there, the constant sex,
You introducing bacteria and whatnot.
risk of
Right.
introducing. So all of this you have to bear in mind, but you could still enjoy it. You could still enjoy
Okay.
it.
So the other question now, how soon after birth can you have sex? That's what they want to know.
Okay. So your postpartum period, that's the period where you deliver your baby. After you deliver your baby, that extends up until 6 weeks.
That's a month and a half.
Yes.
That 6 weeks is really and truly for your body to heal and get back to its pre-pregnancy or non-pregnant state.
Yes.
We suggest that you give your body that 6 weeks to heal before you have sexual intercourse.
Okay, so you can have after 6 weeks, but not
We
before.
come into that after the call.
All right.
Yes.
We have another call. Thank you for calling. You're on the air.
Good night.
Good night.
Good night, Laura.
Good night.
And good night to your guests, the nurses.
Good night.
I must say I am rather baffled by the education I'm receiving on my
Baffled?
television. However, I have been hearing all the good things about them, and I am rather suggesting that they are doing a great job based on the compliment which I have heard they're receiving. But I just want to ask a question. While we know that we have some very good nurses or midwives, are there also nurses that could be very careless?
Go ahead, answer your question.
Yeah,
I mean, for me,
I
I think,
Asking us if we-
yes, if you
we-
would say that there are nurses that can be careless.
Oh, this question has caught me by
okay, all right.
surprise.
Let me just make one statement,
Right.
and then I will drop the line that they can answer.
Yes.
Okay.
The reason I'm saying this, I have heard of certain persons make the complaint that sometimes they would tell the nurses that they are ready to give birth. And then the nurses would tell them they are not ready. And it's like, in those instances, you find sometimes certain mishaps happen.
Okay.
Now,
Okay.
I know of somebody personally who gave me a testimony that she was, on the verge of giving birth. And she felt that she was ready to deliver. However, she was told by the people assisting her or attending to her that she is not ready. And then, now it happened at a hospital. I'm not going to mention which hospital, but in St. Lucia.
Okay.
And then when they turned their back and they left her because they said to her, she's not ready. she gave birth on her own. And that baby was actually falling off the bed. And with the little bit of strength she had left, the Lord
rules, but the rules, it changes. For instance, I know people who have come into hospital 5 centimeters and they say, okay, you can wait.
Yes.
And within
Yes.
a short order, they're already 9 centimeters. So, you know, we have to bear in mind for that. We have another call. Thank you for calling. You're on the air.
Yes. Hello. Good
Can you speak up, please? I can hardly hear you.
Yes. Hello. Good evening.
Good evening.
Okay. Can you hear me now?
Yes.
Okay. I'm calling to speak of this one time. Right now my daughter is 21, and the similar incident to like the gentleman spoke of a while ago. I was
Listen,
having-
can you listen to us on the radio? You listen to your on your telephone. Sorry, you're listening to us on the television. I can hear your television. It's creating a feedback, and there's a delay. So,
Okay.
and we're short on time right now. So, if you can give your experience by listening to us
Okay.
on the telephone. Yeah.
Laura, is it possible that I get your telephone number?
Yeah.
Can I have it, please? Or
46536
okay, just now. Okay, what's it, Laura?
284
284
6536.
6536.
But if you can just run it through so that the nurses.
No, it would take too long.
would take
I would
long.
rather speak to you and
All
you would
right.
say it to them, okay?
Okay, all right.
Thanks, Laura.
Okay, no problem. I appreciate it. I'm sorry, I don't mean to rush.
No, that's fine. that's
Okay,
fine.
beautiful. As long as you understand.
I do.
Yes. Because we're running out of time, and
Yes.
I could sense she wants to share. It's going to take a little bit more time. There's a call. Somebody's asking a WhatsApp. Somebody's asking. A good show, Laura and Ms. Butcher and Ms. Leopoldi. Great show, very informative. If an expectant mother wants to have a home birth, do midwives facilitate that process? Is that a choice that's available to women? You
no,
don't
it's
do-
not. It's
No,
not.
as
It's
far
not
as we know.
available.
As far as we
Okay,
know,
you
no,
don't
we're
do
not
the home
covered.
birth.
Yeah,
Okay.
before I was told they used to do that. The
Yes.
doulas, they used to call them the
Yes, the
doulas.
doulas.
Right, but then as far as we know now, we're
You're
not
not allowed.
covered. Yes,
Unless,
we're
of
not
course, it's a
allowed.
private.
Even with the
If
private,
with the
we're
private,
not
you have
covered.
oh,
If it
okay.
so happened that the person was
Right,
at home and
right.
something would happen and
Uh-huh,
you're there, fine.
uh-huh.
But it's not something that you can.
Okay, you can. Okay,
Right,
so we don't have that
right.
option in St. Lucia.
No, we
Yes,
don't.
as
Okay,
far as we know.
all right.
Yes.
So we don't have that option. So I hope that clears it out for that. For that
Fix
person.
that.
And that would be nice, right? Because sometimes I don't like hospitals. But I understand, especially with the older mom, like you said, you come in with complications or you develop
Right,
complications,
right,
and you
right.
want to be in a controlled setting for
Exactly.
that to happen. Okay, now we're running quickly out of time. You were sharing.
Yes, the sex part is very
Yes,
important because
very
a lot of
important.
the women soon after delivery, they will ask when to resume sex. I guess probably, for the man's sake. Yes. Nurse Jilly said that, it takes up to
6
the
weeks.
caring for the mother up until 6 weeks. Okay. Now I need to let the men know what our vaginas go through.
I'm bringing you back for the Let's Talk
Tearing.
About Sex series.
Tearing.
Yes.
You understand? A lot of damage at times happens down there. 6 weeks is not even sufficient. Okay? So we're not saying wait for 6 weeks. There are persons who heal faster than the other.
Right.
If you're taking care of yourself, doing the sits baths as
6 baths.
sits baths.
Sits baths,
where we
like
tell-
soaks.
Yes, soaks. With warm water in a basin and salt. If you're doing that as was taught, okay? In my experience, I did it and I got healed within less than 3 weeks, okay? And going to your visits, you're being checked up and everything, then your doctor could give you the go-ahead long before the 6 weeks. But then they need to know the trauma that happens down there, and the mothers need to be healed completely.
How do you know if you're healed or not?
That is why you have to go to the doctor. That is why the time is
So the
allotted.
clinic still
That's
continues
right.
Continues
Right.
because
Right.
within 48 hours after you are discharged from the hospital, we need you to go to the health center.
Yes.
So either the day after or 2 days after, we need you to go to the health center because we're going to assess you head to toe. We're going to assess your baby and start giving you the dates for vaccines. Another reason I think it's very important to wait the 6 weeks, we normally introduce your form of contraceptive at that time.
Right.
Right after delivery is the most fertile time for a woman.
Is that right? I know that was
You could get pregnant right after you deliver a baby.
so that's why they're always
to wait.
recommended that they go on a birth control.
Right, and we do speak about it before you leave the hospital. Do you want to take the pill? There's the injection. There's the intrauterine device. We want you to be on something so that your next pregnancy is not soon after, because it can happen.
We have had.
That's why you have the twins that are not twins. You know what I mean? They're like the 9 months apart.
Yes.
Like you have babies.
Yes.
My mother has 2 children born the same year, but they're not twins.
Yes, and we have had that.
Yeah, we have had it.
We have had
We
that.
have had it.
So since we introduced the birth control at 6 weeks,
Right.
wait the 6 weeks for you to start having sexual intercourse. Get on some type of birth control so you're spacing out your children where you can manage better.
I know people who've gone on the birth control and they've gained so much weight.
Yes, that is one side effect
effect.
of it. Also, too, with the tearings and the damages that happens down there, sexual intercourse introduce a lot of germs. a
So
lot of-
again, we still go back to the
Right. So then, if you have
Infection.
a wound that is not properly healed,
Yes,
it's
yes.
just gonna get worse, and you have
Yes.
to wait again. So allow mothers, please take care of yourself.
The 6 baths. How soon do you
Right.
quickly,
Quickly,
because we're out of time.
You start quickly. We just allow you to rest for 4 to 6 hours after your normal delivery, and then we want you doing your soaks right after.
Yes.
6 baths. We want 4 to 6 for the day. And what I tell my patients, try to do 2 in the morning, 2 in the afternoon. If you do one,
Oh, you
at
have to
night,
do 6 baths in a day.
At least
4 to 6.
least. That
Like
will show you-
soaking in your
Yes, you
vagina?
sit in your basin
In your
of
basin?
warm, the warmest
Ah.
water you can stand with your salt. You sit there for 20 to 30
But you have
minutes, and
tears. This is not burning.
that
I'm
is
feeling-
healing, and it's preventing you from getting infection.
and as warm as you could tolerate it, not to burn you.
So you can
Yes.
go home and have all the
Yes.
sex you want.
It works wonders.
All right,
Yes.
ladies,
Yes.
take the 6 baths, please. Take it.
If you
take
want to
it.
have your-
Yeah, so you can have the sex after the 6 weeks.
But
Yes.
allow it to heal, please.
Ouch.
Allow it to heal.
Now we didn't cover all of what we wanted to cover, not even half. So you will be coming back because I think that it's very, very important. It's very important. As somebody saying, I had this incident at the hospital. I started having pains after 9 in the morning. I got to the hospital before 10, and for the whole day, in the labor room, the whole morning in the labor room, and there was this time I told the nurse I was going to choke, and she said, "You're not choking at all." Would you believe that from minutes to 10 till minutes to 8 in the evening was when my doctor was called to decide on a cesarean? Now, when we have you back, we'll talk a little bit about those things. And as I
Yes,
said earlier, I believe in every profession you have good doctors, you have bad doctors. You have good nurses, you have bad doctors. And maybe not bad is the word to use, but negligent. Especially when you have when you're in labor. I know that labor can speed up. You can be contractions can come in every 5 minutes, every 15 minutes, and then boom, it speeds up, and you can go from 5 centimeters to 8 to 9 centimeters in quick time. And so we'll talk a little bit more about that. So ladies, we will absolutely have you back. Final words from both of you. It's after 10, and my producer is telling me, but we'll have you back because we didn't go through a lot of what we wanted to touch on. What are the things that what message would you like to leave with the viewers before we close?
Oh, okay. I'm so privileged to be here. I will be more than privileged to return. Yes. Ladies, it's important. It's very important. I wouldn't say advice, but with all my heart, I want to ask you to take care of yourself after delivery. It's very, very, very important. We take it for granted sometimes. We do anything, we feel that way, we don't say anything, we just believe eventually we're gonna get there. You understand, like the caller said, you have a child, you gotta do what you have to do. But you need, mentally and physically, you need to take time to take care of you so that you could be able to take care of your baby. And the support system is very important, from a mother, from a friend, from a nurse, from a doctor, whomever you could get help from. Don't feel away, look for help if you need it. It's important, very important. Please try to take care of ourselves as much as we can.
Right. And for you,
And I really need that family members, I need y'all to be more supportive. A mother has just delivered. It's not only the baby. I came to see the baby. You come to see the mother too.
Yes.
The mother needs you. She needs you probably even more than the baby needs you. You just want to see how baby looks. You want to see, hold the baby, but the mother is neglected, and it leads to a lot of problems. So we just need the families to be more supportive, okay, for these mothers, and that's about it.
Thank you so much, ladies, for being here.
Thank you.
Thanks for having us.
An hour is not enough.
It's
and
not.
we realize an hour is not enough. Moms out there, I want you to, even if you're just thinking of having a baby, as the nurses said, please visit your doctor before you even conceive, because it's very important to know what's happening on the inside. You might be trying and nothing is happening. Nothing is happening because your body is unable, or maybe daddy is unable. So to avoid all of that trauma, please see the doctor before we leave. Last week I spoke about the Botham Jean Foundation, and I spoke about how I would like to see the Botham Jean Foundation do more in our circumstance, in our St. Lucian context. And I got an email, pretty long, so I can't go through it because we're all out of time. But I was informed that there have been cases where the Botham Jean Foundation has assisted or rendered assistance to St. Lucians within the St. Lucian context. So I want to make that apology for, being misinformed, or maybe I would have misguided the viewers. So a little bit more on that later on, but just to correct the misconception that the foundation was dealing with cases outside of St. Lucia and not paying attention to our local context. That apparently is not the case. So I want to apologize on behalf of anybody that I may have offended. This is where we end the show tonight. Until next week, I will have another riveting show for you, and look forward to Let's Talk About Sex in July. Thank you so much. Until next week, adieu.
Yes, you